Good morning, student. For health education, we will do lesson 12, deficiency diseases. In this chapter, we will learn about the meaning of deficiency diseases. We will also learn about the different types of diseases like night blindness, beriberi, scurvy, rickets, anemia, and dehydration, which are caused by the deficiency of different vitamins. Ha kani kalenong ngin pulia syapang kejing mut jong ka deficiency diseases but kejing pang ki bami na kadaw jong kejing duna ki vitamins ki minerals ha kamet jongi. Vitamins, minerals, water and other nutrients are essential for our body. Nutrients enable the tissues to grow and maintain themselves. They provide the energy requirements of the individual and also regulate the various processes of the body. Ki vitamins, ki minerals, ka but ki nutrients, ki long ki badan kam na kabenta ka jingkwat jingkya jong kamet jongi. Ki nutrient ki arab ya kamet jongi ban he ban san but ban kwat ban kya. Our body cannot function well and we may suffer from deficiency diseases if the right amount of these nutrients is not consumed. Deficiency diseases are the diseases that are directly or indirectly caused due to the lack of nutrients in our diet. These are also known as nutritional diseases. Kamet jangi kanam la banlong kabakwat kabakyat lada duna yakita ki nutrients. Deficiency diseases kamut kajing pang kabami na kadaw kajing duna yakita ki nutrients ha kabam jangi lani kajing duna yaki vitamins ki bapher. Night blindness. People with night blindness find difficulty in seeing properly in the darkness or even in dim light. They can see normally when adequate amount of light is present. Night blindness is an early symptom of deficiency of vitamin A. Ka night blindness kadi ka jingpang berye jangki khmat. Khamtam e hakapor ba lakem dum kabeneng. Kajing berye jangki khmat kadai kadak kashin jong kajing duna ya ka vitamin A. Prevention and treatment. The treatment of night blindness is possible in the cases of early diagnosis. Diet rich in vitamin A should be given to the patient. Shark liver oil, butter, ghee, carrots, spinach, green leafy vegetables, eggs, etc. are some of the rich sources of vitamin A. Kumno panyada ban sumar ya kani kejingpang. Kibriu ki badan ya kani kejing shitom, ki deban ba mi kijhur jirngam, ki ba bon ya ka vitamin A. Kum juru ngila ban pin bam da ki do anut, ka makhon, ka ghee, ki ka jor, ki jhur bapher, bat ka peleng, bat kiwe. Beriberi is a kind of nutritional disorder or disease caused by deficiency of vitamin B. It is characterized by impairment of the nerves and heart. Deficiency of vitamin B also weakens our muscles, which may result in paralysis. Ka beriberi kadi kajing pang bami na kajing duna jong ka vitamin B. Kani kajing pang kapindko ya ki thiet ki jaw bat ka kta ru ya uhat. Kajing duna vitamin B kapintulot ru ya ki doksa bat kala ru banlam sya kajing pang paralyze ni kajing pang yap shiliang. Beriberi is caused by the deficiency of vitamin B. Symptoms of beriberi include loss of appetite, digestive irregularities, swollen joints, tiredness and a feeling of numbness, pain and weakness in the limbs and extremities. Kidak kishin jong kani kajing pang beriberi kalong kajing bam thangan kajing bam teliat bha kakpo kajing at ha ki join ni kiman kajing thait bat kajing sngow tersany ni sngow bendo kajing pang bat kajing telot jong ki kti ki kejat ringkat bat ki shimpria kti shimpria kejan. Prevention and treatment of beriberi. Vitamin B is found in a form of a thin layer as upper coating of seeds. Vitamin B complex cannot be stored in enough quantity in the body, so it should be included in our regular diet. Eating grains, nuts, unpolished rice, milk, green vegetables, cabbage, and fruits of leguminous plants is helpful in order to get rid of beriberi disease. Kilat yada pat jing sumar ya kajing pang beriberi. Ngidan kamban bam shibun ki jing bam ki badan ya ka vitamin B. Kum ki rimbai, ki shana, ki kau, ki krai, ukau ibom pat polish, kadun, ki jhurjir ngam, ukubi, ki so, bat kiwe. Scurvy. Scurvy is a disease of the skin, gums and hair due to the lack of vitamin C in the body. Scurvy commonly affects people who never take fruits and vegetables. Kascurvy kadai kajingpang ha kasni do, ha ki do benian, lani ha kisnyu. Kadau kolong na kajing duna ya ka vitamin C. Bat kajia baha ha ki briu ki bam jubam so ni jhur. Causes and symptoms. The main symptoms of scurvy are formation of spots on the skin, spongy gums, and bleeding from the mucous membranes. The person suffering from scurvy looks pale, feels depressed, and is partially immobilized. Pain will appear in the muscles and joints of the body. When the patient has cuts or wounds, they take a long time to heal properly. There is swelling and bleeding in the gums, and teeth become loose in the severe cases of scurvy. The hair and skin becomes rough and dry. Kidak kishin jong kajing pang scurvy kalong kajing pair hakasni do kum kispot. Ni kajing at kidok benian bat kajing misnam hakmut. Kibriu kibadon ya kani kajing pang kilong blai kisngo si bat kim kwa trei kwa kta. Kakta ru ya kibenian da kaba pensenger lut ya ki. Kisnyu ru kilong terkong bat sniudur. Prevention and treatment. By simply consuming vitamin C in our regular diet, we can prevent scurvy. Vitamin C is found in citrus fruits such as oranges, lemons, mango, amla, guava, olives, grapes, and vegetables including tomatoes, green pepper, potatoes, etc. Ngila banyada ya kani kejingpang da kabangi bam kijingbam kibabon ya ka vitamin C. Kum kisok nyamtra, sok jau, sok ping, sok meleng, sok grapes, nang ta kijur bat kum usok sao bat upan, bat kiwe kijingbam kibabon Rickets. Rickets is commonly a childhood disease. Basically, it is a disease of softening of bones. It is a disorder caused by a lack of vitamin D, calcium, or phosphate. Vitamin D is absorbed from food or produced by the skin when exposed to sunlight. Ka rickets kadai ka jingpang ka bakin ray bha hagi khulung khana. Kadai ka jingpang jam shieng bat ka jia na ka daw ka jingduna ya ka vitamin D, ka calcium lane ka phosphate. Kani ka vitamin ka yarap ban pin klan ya ki binyan bat ya ki shieng. Kidak kishin kilong ki jing kedor ni ki jingkap ha ki kejan. Prevention and treatment. Diet rich in vitamin D and exposure to sunlight for some time is necessary for preventing rickets. Cod liver oil, sunlight, salmon fish, cheese, cream, yogurt, and eggs are rich sources of vitamin D. Nila banyada na kani kajingpang da kabangis aj sngi shipang ha kapormin stem. But da kababam kijingbam kibabun ya ka vitamin D kum ka umhnyang liver, ka dok ka kleng, ka cheese, ka cream, ka peleng, bat kiwe. Anemia. Anemia is a disease caused due to lack of iron in the body. When a person is suffering from anemia, he has low amount of red blood cells. Red blood cells contain hemoglobin. Hemoglobin carries oxygen around the body. Ka anemia kadai ka jingpang dunas nam. Ka jingduna yaw iron ha ka met jongi kawan lam ya ka jingpang anemia ni dunas nam. Kibrio ki papang anemia ki duna ya kata ka hemoglobin ka bayarap banra ya ka oxygen ha baro ki benta jong ka met jongi. Causes and symptoms of anemia. Anemia is caused by the lack of red blood cells in the body. The symptoms of anemia are heavy bleeding due to injury or internal bleeding and inadequate intake of iron. Symptoms of anemia are difficulty in breathing, fatigue, dizziness, hair loss, brittle nails, weakness, irritability, etc. Kada bukong santam jong kani kajingpang anemia kalong na kajingduna ya kita ki red blood cells. Kidak kishin jong kani kajingpang jingstom kalong kajing jenjar ring mensiam kajing khat jingjrem ni kajing tlon kajing king bayong kakli kajing haps new kajing shrine kitasim bat kiwe. For prevention and treatment of anemia, we should eat raw vegetables and fresh fruits which are rich in iron. Vitamin B is needed for preventing or curing anemia. Beetroot, spinach, lettuce, leaves of fenugreek, soybean, almonds and honey are rich sources of iron. Ngidayban bam kijingbam kum kichurim but kiso kipai kibabun yaw iron. Ngidayban bam kijingbam bashat sirwa. Ngidayban bam ru ikijingbam kibadan ya ka vitamin B. Kijhur kum ubit, upalong, usalad, usoybean, almond ka ngap bat kiwe. Dehydration. Dehydration is a disease caused by excessive loss of body fluid. Human body is made up of 70% water. Dehydration kadai ka jingduna ha kamet jong ubriyo. Kamet jong ubriyo kadon kumbanyo ko persen ka balada duna ha kamet la ban pang ban shitom. Causes and symptoms. Losing larger amounts of water and playing for long hours outside can create the problem of dehydration. Symptoms such as thirst, nausea, headache, tiredness, muscle cramps, especially leg cramps, decreased blood pressure, dizziness, or fainting are commonly seen in case of dehydration. Kidak kishin kum kajing trang kajing smoking bayong kenroy pri, kta kli, thaj, kiuksa, kajing smo beria gikmat, kajing hair ka BP, bat kajing khitlot bat kiwe, kadai kadak kashin jong kajing duna ha kamet kaphan. Prevention and treatment. Drinking fresh water and stopping the loss of fluid is the most effective treatment for minor dehydration. In severe cases, water with other fluids containing a proper balance of electrolytes should be given to the patient. tie ngidon kam bandi shibun ka kenang banlait na ka jing terkong ha ka met jengi. Nila ru bandi ya ka ORS ladangi snotlot palan. My dear students, that's all for this chapter. Check out the exercises for your assignment.